All right, I've got a bowling ball today. Welcome, Big Fish family, to another episode of the analogies, because we can use everyday things like a bowling ball to get our point across to our patients to increase the engagement so that they understand. We need understanding from our patients so that they commit and make it a point to follow through with the care plan that we're recommending for them. And a 13-pound bowling ball is exactly what you need to explain that your head is the exact same thing as a 13-pound bowling ball. Your head weighs 13 pounds. Most people have no idea how much their head weighs. If you ask them, they'll probably say, I don't know, 3-4 pounds. No, it's 13 pounds. And if you actually held a 13-pound bowling ball in your hands, it feels pretty doggone heavy. But what's awesome about our neck is that it's created, our neck has a nice curve in it. And so when that 13-pound bowling ball sits on top of that curvature, that curve and how the muscles are connected, man, it is an awesome system. It is a great creation that your neck can actually support that. But when you lose that curve in your neck, all bets are off. All things go to heck, because with that 13 pounds now is sitting up on top of a very straight curvature and a very straight spine. I've got an example of one right here so you can actually see it. This is a young man that's got a very straightened cervical curve. In fact, there is no curve. It's perfectly straight. It's like military neck. There is no curve. And when there's no curve, now we've got this 13-pound bowling ball sitting on top of no curve, and every step you take, that bowling ball is compressing your spine, and you don't have that nice flex that you would normally have with that good curve. And what's even worse is that once that 13-pound bowling ball is out in front of your body, that 13-pound bowling ball is sitting forward, and little by little over time, that bowling ball pulls your shoulders forward. And if you want to know why people, when they're 65, 75, 85 years old, are bent over and they have like the humpback, okay? Everything is crunched forward. If you wonder why that is, it's because they lost the curve in their neck years ago. And here's the thing. Nobody on the planet wants to look like that. Nobody wants to look like a hunchback. Nobody wants to look like that. But no doctor, and I mean nobody, unless you're a great chiropractor, is talking about what you need to do to avoid that. So why aren't we talking about it? We need to tell people, look, when you've got this going on in your neck, you've got to correct it, because where it's going is hunchback, crunchback. 25, 30 years from now. And be the chiropractor that's bold enough to actually tell people the truth. That if you don't fix that, that's where it's headed. And you can't wait until you get there and then try to fix it, because it's impossible to fix it then. You got to fix it now when you're younger, healthier, it's easier, and guess what? It's less expensive, okay? So you can do it a lot more affordably if you actually fix it when you're young. So use the bowling ball analogy. People understand weight and what it can do if it's in the wrong position. And all you have to do is put a bowling ball in somebody's hands and they can tell and they can feel it. And all of a sudden the light bulb goes on and now you got them. They're engaged. They're going to follow through. Thanks for listening. We'll talk to you again soon.